Hello, this is Dr. Cyril H. Wecht. I am a forensic pathologist and medical legal consultant. I am also an attorney. I don't practice law, but I utilize my legal knowledge, background, and training in the work that I do. I have been practicing as a forensic pathologist since 1962 to the present time. I do autopsies for 4 counties, coroners and district attorneys surrounding Pittsburgh, Allegheny County, and private autopsies for families and attorneys upon request. I do consultations for attorneys all over the United States and sometimes from foreign countries in a variety of civil and criminal matters. It could be medical malpractice, wrongful death, workers' compensation on the civil side, and it could be murder, rape, sexual assault, child abuse, whatever on the criminal side. I've been doing this then now 62, following completion of my training, 5 years in pathology, following the 4 years of medical school and a year of internship, and 3 years of law school. I also served 2 years as a captain in the United States Air Force during that period of time, and served as an associate pathologist at Maxwell Air Force Base Hospital in Montgomery, Alabama. I was the coroner of Allegheny County, Pittsburgh surrounding communities for 20 years, 2 separate 10-year periods, 1970 to 1980, 1996 to 2006. I had been an assistant district attorney for almost 2 years back in the mid-60s, and served as a medical legal advisor to the district attorney of Allegheny County. I'm pleased to have been invited to make this presentation, and I hope that all of you who are listening to this presentation will learn something from it. I am very sorry that this cannot be a live audience. I much more prefer that with that kind of interchange and the opportunity for questions and comments. So let me proceed, and I'll follow more or less a kind of an outline that I submitted at the request of the folks who are sponsoring this program. And we chose as a title, Forensic Pathology, From Crime Scene to Courtroom, Evidence to Testimony. So let's start. We have the crime scene, and it's interesting in light of what has been going on in calamitous, catastrophic fashion in the United States of America in just the past few weeks, months, and what is still going on with the Chauvin trial, now concluded, to go to the jury next week, and with other cases still being handled, the shooting of someone by an officer using a gun instead of a taser, by another video I saw today of a 15-year-old African-American boy, looks to me putting his hands up and being shot. I don't want to digress completely into police-related deaths, although we'll certainly be talking about that, and what we shall be discussing encompasses all of those kinds of cases. So we talk about the crime scene. This can be known, alleged, or suspected crime scene. It may not necessarily be a crime scene. You don't know that when you have a case reported to you, a body being found. It could be in the water, the lake, the ocean, a stream. It could be anywhere, in a house, on the road, and it may appear to be someone who has been traumatized. There could be blood and so on, but you don't know, do you? Is it a homicide, accident, or suicide? Let me point out The medical examiner, the coroner, and I'll use those terms and refer to those offices in a kind of, overall sense, no differentiation for purposes of this discussion. The death certificate, ultimately to be written by the office, ME or coroner, includes not only the cause of death, A, due to B, due to C, the contributing factors, but also includes something not found on a death certificate written, completed by a doctor, whether it's private practice or at a hospital, and that's the manner of death. Those death certificates don't include manner of death decisions. The ME coroners do, and there are 5 possible manners of death. In decreasing order of frequency of occurrence, you have natural, accident, suicide, homicide, and undetermined. You can see in the recently completed presentation in the Chauvin trial, obviously the prosecution is saying it's a homicide. The defense witnesses suggesting it might be natural, and one of them said, well, he might have signed it out as undetermined. So keep that in mind. So back to the discovery of a body. You want to be very, very careful in not contaminating the scene. We have long known about this, going back to, Locard's principle, L-O-C-A-R-D, a French criminalist of the early part of the 20th century, that anytime there is a contact between one person and another, or between a person and some inanimate object, there will be the transfer of evidence of that contact, Locard's principle. Well, it's pretty true, although with gloves and things like that, maybe you can avoid leaving evidence. But we're talking then about things which are beyond those that are obvious, that are immediately evident, but trace evidence. This includes hair, fibers, fingerprints, shoe prints, little pieces of anything. It could be grass, it could be soil, whether it's on somebody's shoes or clothing or whatever. So all of that has to be kept in mind when you have a scene. You don't want to contaminate it, because these are matters which, while seemingly trivial, perhaps to the viewer at the beginning, may, in a courtroom with skilled attorneys, whether they're just being obnoxious as they can be, brutal as they can be, skilled and competent as they frequently are, you never know, and they'll get into something from the very beginning. So you should keep that in mind. If possible, depending upon the seeming appearance of the case, you may need to have the forensic pathologist and a criminalist and a forensic photographer, as well as the homicide detectives, present at the scene from the time the body is discovered and nothing is contaminated. The scene is cut off, and nobody does anything until these people come. Now, unlike television, this isn't going to be the case across the board with all deaths. Nobody has that kind of manpower, nor is it necessary. It's not required, but it should be kept in mind. Obviously, in more rural areas, you're not going to have such people available. And in larger metropolitan areas, while people like that are available, they're pretty busy too. Going back several decades, from the beginning, for example, of the medical examiner's office in 1877 in New York City, it was customary for a pathologist from the office to go to the scene of every case. Well, many years ago now, they discovered that was simply not going to be physically possible. It just wasn't going to be feasible from a manpower standpoint. And so while that is optimal in something that you talk about, pragmatically speaking, it's not going to happen. But taking pictures by a skilled photographer is important, because photographic evidence of what was the position of the body, what was the spread of the blood, what was the relationship of articles of clothing, where was the gun in relationship to the hand, trying to see if it's a suicide versus an accident versus a homicide, and so on. So those are things that you want to keep in mind. There's no hurry, there's no rush. The individual is dead. You do want to check for rigor mortis, body stiffening, livor mortis, gravitational settling of blood in the dependent parts of the body, depending upon the position of the body when the individual dies, and algor mortis, body temperature. That should be done. And so frequently it is not done, because then as hours go by, the scientific validity of those criteria becomes ever more weakened. These are not, unlike a novel, fixed times to the minute or even to the hour. There's a spread. And so you want to move quickly. Failure to have done so, for example, in the Nicole Simpson case, in the JonBenet Ramsey case, that was very, very bad, because it was important to try to determine when Nicole Simpson and Ron Goldman in the O.J. Simpson matter died. It was important to know when JonBenet Ramsey died in reconstructing everything. So aside from that, though, once you've done that, then there's no big hurry. So you should not rush the crime scene review. Now the body is taken by the representatives of the Medical Legal Investigative Office to that office. It is further identified, and again, things have to be done in documented fashion. Photography is important along the way, because questions come up then about, again, the position of the clothing, position of the head and the hand, and so on, as rigor mortis begins to maybe leave the body, as the body is being moved and repositioned inadvertently, and so on. So these are things that need to be done. With the body there finally on the table, further identification, photography, collection of evidence. Routinely, hair, head hair, body hair, pubic hair are collected in cases of suspected rape, sexual assault of any kind, oral, anal, rectal and vaginal swabs with a woman, oral and rectal anal swabs with a male. So those things are done. Fingernail scrapings and then fingernail clippings are done. And then if there are other things that need to be collected, items, observations on the clothing before the clothing is removed. That is done in organized, systematic fashion, again, photographing things as you proceed. So then, when all of that is taken care of, the forensic pathologist moves in with her assistants, and you begin the actual dissection of the body. Customarily, and I think most forensic pathologists prefer to open the head first, because that allows then blood to flow out and presents a more valid picture when you get into the thoracic and abdominal organs. You make the incision over the scalp, observe what you have beneath the scalp. And then you remove the calvarium, the bony top of the skull, and look to see any evidence of epidural, subdural, subarachnoid hemorrhage. Then, again, photographing as you go along, anything of an abnormal nature, and even routine pictures to show that there is nothing that is abnormal or atypical. When the brain is taken out of the cranial vault, then you examine the base of the skull and document that. Then you examine the brain. In most cases, the brain will be examined at the time. Where the brain has been traumatized, whether by accident, suicide, homicide, gunshot wound, blunt force trauma, it is wise in cases that may be homicides or cases that present a problem to not examine the brain at that time. A brain is as much a viscous, very thick liquid as it is a solid in the fresh state. And when it is traumatized by gunshot wounds, it will begin to fall apart if you try to cut it. So you fix it in formalin. You may remember from your high school and university classes when you work with specimens in your biology class, whether it was a frog or a whatever, and so on. You fix it in formalin and it hardens. And not to be crude, but to get this point across, you now have something that had the substance of a well-done soft-boiled egg to begin with that would flow and fall apart to a substance with a firmness of a hard-boiled egg. So you serially section it like you would a hard-boiled egg in making a salad. And now you can follow through. This, for example, was not done in the John F. Kennedy assassination. We came to learn later on that the brain, while removed and placed in formalin properly, and while the pathologists went back 2 weeks later, they never dissected the brain. They never examined it. I have my thoughts as to why, because it would have shown exactly that there were 2 shots that hit the president in the head, one from the rear and one from the front, but that's the subject for another day. The point is that discussion of a highly controversial nature continues to this day vis-a-vis the JFK assassination, largely because the brain was not examined. You can't do that. You have to examine the brain properly, and you do that after 2 weeks. Other times you fix the brain and a neuropathologist examines it when you're looking for neurodegenerative disease processes, Alzheimer's, and the various neurotropic diseases, Parkinson's, amyotrophic lateral sclerosis, Lou Gehrig's disease, multiple sclerosis, and so on, with special stains that the trained forensic neuropathologist does. After you're through with that, then you open the front of the body with a Y-shaped incision, called that. You begin front of the shoulders, and you come down diagonally, and then at the base of the sternum, the breastbone, continue in a straight line through the abdomen. You reflect the soft tissues, and then after you've checked the rib cage and the sternum, then you remove the sternum, electric saw, cutting it off from the rib cage, and you now have access to all the organs and tissues in the thoracic and abdominal cavities and into the pelvic cavity. You look at everything in place. Remember, you're photographing anything of an abnormal nature. See if there's any liquid that has accumulated, blood or other fluids. And then, before you go further, you collect things for toxicological analyses. That includes blood, ideally taken from the femoral artery, as opposed to blood from the heart. It's more valid in terms of the distribution pattern as to what was extant in that body when the individual died, more so than blood from the heart. So you get blood, ideally, from that femoral artery. Then you get bile, B-I-L-E, from the gallbladder, urine from the urinary bladder. Those are the basics. You may then be acquiring a tissue also for toxicological studies, depending on what you're looking for. gastric contents many times. But the three body fluids that are important are blood, bile, and urine. Blood will tell you what was present when the individual died, and therefore what was being played out physiologically. That which is in the bile, B-I-L-E, will give you some idea of what had already been metabolized by the liver and stored in the gallbladder, which is what bile is. The liver metabolizes and stores. And then urine, later, after everything has gone through and it's been excreted by the kidneys. So again, referring to the Chauvin case, testimony by the defense about George Floyd having ingested some pills or substance after he was arrested, it's of no consequence. It was total ludicrous nonsense designed to confuse the jury, because aside from the fact whether or not he did that, it's of no consequence, because that which he may have taken into his mouth during this altercation that went on for some minutes would have had no meaning at all going into the stomach. It takes 30, 40 minutes, even on an empty stomach, to be absorbed. How difference does it make? This is the kind of nonsense that I, as an attorney and a medical legal person, really despise. I recognize what attorneys try to do, but that doesn't make it more palatable and acceptable to me, because I consider it to be unethical and improper and a sign of lack of some competency and basic decency. So now, after you've acquired those specimens, you begin to remove your organs. Usually, most of the time, organs are removed separately. Sometimes they're removed, we say, en bloc, E-N-B-L-O-C, en bloc, together. But most of the time, individually. You weigh, you measure, you feel, you get a sense of the consistency, and you describe things. You again have your assistant or the photographer, depending again on the nature of the case. If it's a gunshot wound case, you want to document as you proceed in from the gunshot wound of entrance that you've identified into the body organs and tissues. Where did the bullet traverse? And then you go all the way through to the exit wound. And then sometimes you may insert a rod to show the directionality of that gunshot wound. Just this past week, we had 2 multiple gunshot wound cases. For Chicago and New York, it's routine, probably daily. We're not a rural community in Pittsburgh and the communities for which I do autopsies, but still 2 multiple gunshot wounds within a matter of a few days is not that common, even in one of those homicide centers. And those are difficult cases. You got to identify and differentiate between entrance and exit. Contrary to what people believe, sometimes it's not clear-cut as to what is entrance and what is exit, depending upon the location of the weapon in relationship to the body, and whether there's gunshot powder residue, a deposited stippling pattern that comes out with the burning carbonaceous particles within 24 inches fired from the victim, and so on. So you do all of that. Then you take pieces of tissue after you've weighed and measured and palpated and described everything. You take what we call representative sections. You take pieces of all of the major organs and smaller organs and submit them in formalin. We call them representative sections because you want to get something which is representative of both pathological changes as well as normal appearing tissues. And those are placed in formalin for microscopic slide preparation. Just like the hospital pathologist gets the appendix or the lung tumor or the piece of kidney from the hospital surgeon, she examines it and makes a slide and looks at it under the microscope. It's the same thing with the forensic pathologist. So now you've got working for you toxicological analyses by a toxicologist in a separate laboratory, and you've got slides being made. You may have made some cultures. Sometimes you want to see if there's an infectious process. So you do a culture with a swab, and you get back to the slides of the swabs you've made, looking for possible evidence of rape, sexual assault, looking for seminal fluid, looking for spermatozoa, and so on. And you're getting all of that to come back to you. Now you're getting further information from your own personnel, as well as the homicide detectives, and so on. And you put everything together. I want to make a very important point. You do not rely upon information from the police and homicide investigators if it were scientific testimony. You are not an adjunct of the prosecution. Look at the National Academy of Sciences report in late February of 2009. They made it clear, this most prestigious group of scientists in the world, National Academy of Sciences, making it very clear, something that I had talked about for decades. Not that I was the first or only person, but I was so proud and thrilled to see that published in February of 2009, that people in the fields of forensic science, whether the pathologist, the criminalist, whoever, you are not an arm, you are not an extension of the prosecution. You are functioning as a forensic scientist. So unlike the pathologist in the George Floyd case, the Hennepin County medical examiner, who gave a diagnosis of cardiopulmonary arrest occurring during the subdual of the victim, during physical restraint, application of physical restraints, and so on. Total prosecutorially biased way of presenting a case. First of all, cardiopulmonary arrest is not something you see grossly or microscopically. It means heart and lungs stop, right? Cardiopulmonary arrest. When you die, everybody, you're going to have cardiopulmonary arrest. If there's a clinician present when somebody goes into that kind of clinical situation, then he, she can say cardiopulmonary arrest. They see it, they hear it with the stethoscope, they view it on the electrocardiogram. You're not seeing that at the autopsy table. That's number one. Number two, you don't use that information from the police during subdual. A noun you won't even find in some dictionaries. We know what it means. And during the attempt to restrain or whatever, and so on, this kind of partiality was demonstrated during the testimony of the medical examiner who testified, obviously, with great discomfort and displeasure called by the prosecution. So you take all this together, and then you put together a postmortem protocol, the autopsy report. That autopsy report should contain things of an objective scientific nature. If you want to express opinions, then you may be consulted by attorneys, by the district attorney, by whomever, families in private cases. That's a separate written document called a medical legal report. When I get a consultation and I do an autopsy, I give my autopsy report. That's one thing. And the consultation report is separate. You do not admix your subjective interpretations with the objective findings. I want to pound that point home. Understand you're a forensic scientist. If you want to be a police officer or a homicide detective, wonderful pursuits, do that. Don't get it confused with being a forensic scientist. I pound that point home with students, any who are listening. Make up your mind. You want to be a policeman? You want to be a district attorney? Or you want to be a criminal defense attorney? Or do you want to be a scientist? Keep that in mind. So there's your final postmortem protocol, and your medical legal consultation report. I see now we've come to 30 minutes. I hope I have covered everything for you from beginning to end, from crime scene to courtroom, evidence to testimony. I hope that I've made some points that will be helpful to you as you pursue your present and future careers. And maybe if you are a teacher, keep these in mind, things to get across to your students. Thank you very much, folks. I wish you well in all of your future endeavors. Best wishes.